Hello everyone, this is Medical Lecture Series and today I'm going to cover ENT. These lectures can be useful to any Plab 1 candidates or UKMLA candidates or anyone who is studying medicine including medical students or working doctors. So before we dive into diseases, let me give you a small introduction about basic structure of the ear and the clinical importance of them and what are the investigations you need to know for your medical exam. So to start with, the ear divided into three parts, outer, middle, and inner ear. Outer ear consists of external ear or the pinna and the ear canal. Middle ear start from eardrum or tympanic membrane and the three little bones, which is called ossicles and eustachian tube. This tube is the one connecting the nasopharynx with the middle ear. So infections from the nasopharynx go through this tube up to the middle ear. So that's why it is clinically significant. Basically, what happens is when the sound wave come through the ear canal, it hit the eardrum and cause it to vibrate. This convey the sound to three bones, malleus, stapes, and incus. At least you have to remember the stapes one because this will come in osteosclerosis. When it comes to inner ear consists of three semicircular canal and the cochlear system. The main function of the semicircular canal is maintain our body's balance, while the other hand, the cochlear system is necessary for hearing. So remember this point. It is important to understand the different symptoms of each condition. So please keep in mind, according to the structure affected, the symptoms will appear. For example, if cochlea is affected, it will cause hearing loss. If there is any problem with semicircular canal, it will cause like symptoms like imbalance, vertigo, and nystagmus. Inside the inner ear, there is a liquid called endolymph. So why I talked about this endolymph? In Meniere's disease, the main pathology is accumulation of endolymphs. Alright, guys. Let's move to the cochlear system. The cochlear system is a complex structure. You don't need to know in detail, but just remember it consists of some hair cells, tiny hair cells. It converts the sound into electrical impulses. When there is a damage to these intracochlear hair cells occur, it results in sensory neural hearing loss. So I hope you understand the rationale behind using the cochlear implant for the sensory neural hearing loss. This implant will directly stimulate the spiral ganglion cells. Finally, the information from the inner ear conducted through eighth cranial nerve, which is also called vestibulocochlear nerve, to our brain. I think this is all you need to know about ear anatomy and its function for the UKMLA exam or your Plab 1 exam. Another very important thing for you to understand about ear is hearing loss. Whenever a person have hearing loss, it can be conductive or sensorineural. Please remember, conductive hearing loss occur when the sound waves can't conducted to the inner ear. So any pathologies in between the external environment and the inner ear will cause this conductive hearing loss. So for example, let's say if the fluid is filling inside the ear canal, so it will block the sound waves reaching the inner ear. Same occur with foreign body and wax. Likewise, some issues with eardrum or ossicles will also cause this. What about sensory neural hearing loss? This is due to problem with inner ear or cochlear nerve. When I say inner ear, specifically, it can be due to damage to the intracochlear hair cells or reduced movement of them or any problem with endolimbs. One of the main known cause of this is aging, in which loss of hair cells is the one reason for this. The other important cause is noise. So, what happens with noise? When someone exposed to harsh noises, it will damage their hair cells. There are few other causes of sensory neural hearing loss you need to know about, such as infections like mumps, Meniere's disease, and some drugs. I hope it's clear for you all about hearing loss. So we will see most of these causes one by one later in detail.